Yeah.
And our share still not.
Yeah.
I'm sorry, but I think I
So
will
let's
have
are
to
you
share
going
first.
to share?
Yes,
Okay.
I'm going to share
You're going
first.
to share. Okay, fine.
Please confirm if you can see my screen.
Yes, we can.
Yeah.
Thank you.
And thanks. I got that, Sulan. I'll save it and then open it on PowerPoint rather.
Caitlin, I will just wait then for you. Go ahead.
Because we're just setting up facility, so we'll be done in a moment. Just give us a few minutes.
No problem.
All righty. We'll give you a go ahead, Mapuselet, to just sorting out a few things quickly. Yes. Yes. Mapuselet, we're about to start, but just give me a few seconds. I want to click start so it renders before you can start speaking.
On YouTube because I've already, I don't want to press anything else. Have I just looked?
So yeah, just stay on mute, and then when I say go, I'll start the meeting shortly, in like a few 2 seconds actually. I'll just press start meeting. Now you'll see it will change the color from not started to live.
Can't see that from my side. Just give me a cue.
All right. We're about to start.
Okay. Day and welcome to the 2025 EISA workshop. My name is Buselisa Mokano and I represent the Office of the Registrar from the South African Pharmacy Council. We are happy to have you join us today for the workshop. Please take note of the following important information before we start. This session will run for 3 hours. Kindly stay until the end to gain the full benefit of the workshop. To ask questions, please use the Q&A function available on MS Teams, YouTube, or Facebook. Towards the end of the session, you will be requested to complete a survey to confirm your attendance and provide feedback on the workshop. Presentations and other material will be made available on the EISA website after the workshop, and we look forward to engaging in an informative session with you. The program for the day, we will have Dr. Fogati taking us through the format and content of the examination or assessment, the preparation of the calculation questions, as well as the example. We will have a Q&A and a break for about 10 minutes. Then we'll go through this general section, that's the question and examples. Then we'll have another 10-minute break, and then we'll look now through the remote examination preparation, and then we'll have our Q&A right at the end of the session. I'll hand over to Dr. Fogati then to start the session. Thank you.
Good morning, everyone, and welcome to this workshop. I hope that it is informative for you and that it helps you prepare for your exam, your upcoming exam. I'm going to turn my camera off, but I just wanted you to see who you're speaking to, or who's speaking to you, I should say. So enjoy the session, and please feel free to ask questions. Right, so today I'm going to show you the format and content of the examination so that it gives you a good idea of what to expect during the exam. We're also going to spend some time preparing you for the calculation questions so that you have an expectation of the level of calculation questions you will be asked. Similarly, for the general questions, and then the office, as Puseletho has told you, will take you through the remote online examination or assessment. Those of you that have already done the basic EISA, or if you have done the basic EISA in the past, you will be quite familiar with Council's online examination or assessment, but it's useful to go through that again. So as far as the format of the examination is concerned, it is an open book online examination, and it consists of 120 multiple choice questions. The overall pass mark for the exam is 50%, and the exam is 4.5 hours long. The important thing to know is that even though it's a multiple choice question exam, we do not employ negative marking. And so it's important that you understand that from the beginning, so that you aren't hesitant in terms of answering a question and that it just gives you the confidence to, if you see the correct answer, that you can mark that correct answer without being concerned that a mark will be taken off if it's incorrect. Okay, so the exam has 25% of the questions are multiple choice calculation questions and 75% are general questions. That means that there are 30 questions that are calculations and 90 questions that are general questions. The key here about the calculation section is that you have to get 60% for the calculation section. So the pass mark for the 30 calculation questions, you have to get 60% of them correct. And then for the general question section, you only have to get 50%, which is 45 out of 90 for that section. The way the exam timing works, it's all one exam. You don't write a separate calculation exam and a separate general exam. It's all one exam, and the calculation questions are mixed up within the exam in between the general questions. Okay, but you will have more or less 1.5 hours to complete those 30 questions and a further 3 hours to complete the 90 general questions. Okay, there's plenty of time to get through all of the questions. If we look at the exit level outcomes, we are training, the EISA is developed and to assess a generalist. That means that you can work in any sector of pharmacy if you've written the EISA, community, institutional, manufacturing, or wholesale. And so the questions that are in the paper are related to any of those sectors according to the exit level outcomes and the tasks that you are expected to be able to perform in any one of those 4 sectors. So if we look more closely at each of the exit level outcomes, ELO 1, similar to the basic ELO, is to apply basic scientific knowledge to provide technical support in delivering pharmaceutical services. So a lot of general questions will come out of that may be linked to law and ethics. It may be linked to communication. It may be linked to a skill that you need to be able to do. So quite a general section, and even pharmaceutics, so understanding your dosage forms will come through in that section. And then for ELO 2, providing technical support for ordering, managing, dispatch, and disposal of medicines and scheduled substances, medical supplies, and devices in compliance with good wholesale and distribution practices and legal requirements. So ELO 2, again, similar to the basic ELO, is very much around stock and stock management. And I know that in your courses, whether you did the previous course or whether you've just completed the new Quality Council for Trade and Occupation certificate, this is extensively covered in your course material, anything to do with stock or stock management. And then the third ELO, ELO 3 in yellow, is to provide technical support for the manufacture, packaging, and repackaging of both sterile and non-sterile medicines and scheduled substances in compliance with good manufacture guidelines under the supervision of a pharmacist. The difference between your basic and your post-basic scope of practice is that a post-basic assistant can now be involved in the manufacture and or compounding of both non-sterile and sterile medicines. So there is a focus in terms of ELO 3 and ELO 4 on sterile products and sterile manufacture. ELO 4 then refers to the extemporaneous compounding, again, of both non-sterile and sterile, depending on where you're working and whether the facility that you're working in is able to do sterile compounding. But as a generalist writing this assessment, you need to know both sterile and non-sterile theory and the practical skills required for that. And then finally, ELO 5 is to provide technical support to dispense prescriptions and to sell Schedule 0, 1, and 2 medicines in compliance with legal requirements, including good pharmacy practice. So this now is a big change from what you would have covered in the basic curriculum compared to what is in the post-basic curriculum. So ELO 5 will include questions around the scheduling of medicines, because you need to know the difference between a Schedule 0, 1, and 2 medicine, which medicines can be sold within your scope of practice. But linked to that is also the names of the medicines, not the trade names, but the ingredient names, and what the action of those ingredients might be, what the indications of those ingredients might be, and also understanding the limitation of your scope of practice in terms of being able to refer to the pharmacist when necessary. Okay, so this ELO 5 is something that you need to be able to focus on, spend a little bit more time preparing for this one, especially those of you that may have done the older courses. You may not have covered as much in terms of ELO 5 in your previous course compared to the occupational certificate. So this is the split of questions between the different ELOs. In your ELO 1, which is your basic scientific principles, 30% of the questions will come from there. ELO 2, which is your stock management, has 15% of the questions. ELO 3, which is your manufacturing, also 15%. ELO 4, which is extemporaneous compounding, also 15%. And then finally, the sale of Schedule 0, 1, and 2 medicines is ELO 5. In the next few slides, we're going to break down each of your ELOs so that you understand what information, what knowledge questions or problem-based questions might be asked for each of those ELOs. So you will see here in ELO 1, we said it was basic scientific principles, and you can see that it's quite a vast scope in terms of what could be asked here. So as I mentioned earlier, you need to be able to apply legislation that is relevant to your scope of practice. It's very important that you understand as a post-basic assistant what your scope of practice is according to the practice regulations, what you are and are not allowed to do. Now, this is important because many of you might already work in practice and you learn a lot of bad habits from the people that you're working with. And so you actually think that your scope of practice is more than what is legally allowed. We are testing you on what the legislation says. So it's very important that you go and you really understand your scope of practice as far as the legislation is concerned. And then I hope you take that and you apply it in your workplace. Secondly, demonstrating ethical and professional conduct related to your relevant scope of practice in the provision of pharmaceutical technical support services. Now, ethical and professional conduct, we as pharmacy personnel, whether you're a pharmacist or you're a pharmacist assistant, we ascribe to an ethical and a professional code of conduct. Again, those are documents. Professional conduct is Board Notice 108 of 2008. And the ethical rules that we follow is General Regulation 599. And so you need to know what's in those documents, and you need to know and be able to apply what those ethical and professional conduct statements mean in practice. Then, thirdly, you need to apply basic pharmaceutical terms and concepts concerning sterile drug delivery systems. Okay, so in your basic program, you would have focused on non-sterile. Now, in the post-basic exam, the focus is on sterile drug delivery systems. And then apply basic principles, apply to sterile pharmaceutical preparations. And then this is a new section for you, apply basic concepts of anatomy, physiology, and pathophysiology in the context of common acute and chronic conditions. Then your ELO 2, this should be very familiar to you because this is stock management. Apply the principles of good wholesale and distribution practice concerning the management of stock. Conduct ordering and management of stock of medicine, scheduled substances, medical devices appropriate to your scope of practice as a post-basic assistant. Thirdly, to perform stock counts to determine the need for stock replenishment. So you can see that there might be some calculation questions coming in here where you might need to work out some lead times, you might need to work out your minimum stock levels, your buffer stock. You may be given a stock card and be asked to perform a calculation linked to the stock card, your average monthly consumption. And then you need to assess the stock holding for slow-moving stock, expired stock, discontinued, and short-dated stock. So it's important to understand your theory. In other words, what is the definition of slow-moving stock? What is the definition of expired stock? But then it's also important to be able to problem solve. If you get a question that asks you about slow-moving stock, what is the next step that you need to take? Okay, so it's not just your basic understanding. Yes, you must know your definitions and your basic understanding, but you also need to be able to think a little bit beyond that in terms of some problem-solving questions. Then you need to know the documentation and records that need to be maintained, following applicable legislation and process documentation and SOPs as it relates to the management of stock. And then finally, quarantine expired, damaged, and recalled medicines and medicines received from patients and ready them for safe disposal. Can you see how there's some legislation involved in here? You need to know what the Medicines Act says about expired, damaged, and recalled medicines, as well as the disposal of stock in terms of the Medicines Act and the general regulations of the Medicines Act. Right, so now we're moving on to manufacture. And we said that the main difference between the basic and the post-basic is that you've moved from non-sterile manufacture to including both non-sterile and sterile. So the focus of this exam is going to be on sterile manufacture. So you need to be able to comply with pharmaceutical and good manufacturing principles and legislative requirements for the manufacture, packaging, or repackaging of sterile medicines and scheduled substances using aseptic techniques. You need to be able to monitor and control the environment and storage conditions for your materials that are used in the manufacture of your sterile products according to SOPs, and select and implement procedures to quarantine products and materials. You also need to be able to apply legal and special requirements for scheduled substances and control and issue materials according to a procedure. You need to understand what an in-process control test or an in-process check is and what the process is to perform those checks. You need to secure labels and ensure overprinted material is appropriately discarded if necessary when it's unused or damaged or rejected. And then documentation, I'm sure you've heard, if it wasn't documented, it wasn't done. And so it's important that you understand what documentation is required and what records are required in terms of the manufacture of sterile medicines. Our ELO 4 is the extemporaneous compounding. So comply with the principles of GPP concerning the compounding of non-sterile and sterile medicines and substances. Be able to perform calculations to determine the quantities of ingredients required. Compound an emulsion and a suspension following instructions or a formula and using relevant techniques, SOPs, and process documentation. And then again, generate records for each of the preparations produced, making sure that legal requirements and organizational policies and procedures have been followed. You also need to know the processes for checking, cleaning, and sterilizing equipment and performing any other housekeeping activities according to SOPs. And now finally, this one is with respect to the sale of Schedule 0, 1, and 2 medicines. You need to be able to communicate with a patient or caregiver in a professional manner, and understanding that different patients have got different needs, so being sensitive to the patient's needs, as well as the diversity of the patients that we have to speak to. You need to know how to prepare a prescription and dispense a prescription following current legislation, GPP, and organizational procedures, and obtain, in the case of scheduled medicines, relevant information and history, and decide on a suitable course of action in consultation with the pharmacist. Okay, the sale of Schedule 0, 1, and 2 medicines can only take place in a community pharmacy. So all of these assessment criteria are linked to community pharmacy. Provide medicines and or appropriate advice according to good pharmacy practice. Sorry, what I wanted to say is it's taking place in community pharmacy, and a post-basic assistant can only work under direct supervision of a pharmacist in a community pharmacy. So everything in here, although it doesn't always say under direct supervision, it is under direct supervision of a pharmacist. Okay. So providing medicines and appropriate advice under the direct supervision of a pharmacist, according to good pharmacy practice standards. You need to know when to refer a patient and or a prescription to a pharmacist for further management. Remembering, go back to your scope of practice. What does your scope of practice say? What is your limitation in terms of a post-basic assistant in the sale of Schedule 0, 1, and 2 medicines? Yes, everything needs to be checked by a pharmacist. Maintaining relevant records following current legislative requirements, and then promoting basic hygiene, infection control, and healthy lifestyle. That speaks to health promotion, which you are involved in as post-basic assistants. Then the sale of Schedule 0, 1, and 2 medicines. So as I explained earlier, understanding, knowing the ingredient, what the indication of the ingredient is, but even the sale of Schedule 1 and 2 medicines, all of that takes place under the supervision of a pharmacist, under the direct supervision of a pharmacist. And then finally, assist with pharmacist-initiated therapy according to SOPs. Again, referral to the pharmacist when you've started asking the patient questions and realize the pharmacist needs to get involved in this request. So the types of questions, you maybe heard me talk about theory questions and then more problem-solving questions. So that's what I'm going to explain to you now. Throughout the exam, you may get a very straightforward knowledge question. That is maybe just a definition. What is your understanding, or what is the definition of a standard operating procedure, or what is a standard operating procedure? And then your MCQ, your detractors, well, there'll be 4 of them, and one of those will be the definition of a standard operating procedure. And that's straightforward, and you can learn that. Then we step up a level to an application question, where the question is a little bit more applied. And you have to take your knowledge and answer the question based on what you understand and how you've been able to apply that knowledge to the question. And we're going to do some questions just now. And when I do those questions, I will say to you, this is a good example of a knowledge question. This is a good example of an applied question. And then finally, the analysis, synthesis, and evaluation. I will say those are problem-solving questions. So it takes a little bit more than just an application. Perhaps you have to take 2 or 3 pieces of information that have been given to you within the question, and you almost have to think what you would do with that. Yes, you've been given options in terms of choosing, but it takes you a thinking process and a problem-solving process to realize which of those answers is the correct answer. So it's a step-up approach from a basic theory question through application into a problem-solving question. So now we talk about the actual exam. Now you know what the content of the exam is. We need to also talk about preparing for the exam. So from an administrative point of view, you need to know what the date of the exam is and what time the exam will be written, and think about the venue in which you're going to write the exam. Council will explain to you a little bit later on more about the venue. You don't have to come to Pharmacy Council's office to write the exam. But if you do need to, you need to make that arrangement. Otherwise, make sure that you have an environment that is quiet, that is conducive to exam conditions, that other people are not in the room with you, that it's a quiet space, so that you can focus on your exam. And make sure that your connection, because it's an online exam, you have to have a reliable Wi-Fi connection. And then what resources do you need with you to be able to write your exam? Okay, so that's just an administrative point. Then, as far as preparation is concerned, how are you going to prepare for the exam? Which references do you need and how do you use those references? An open book exam doesn't mean that you mustn't prepare beforehand. In fact, for an open book exam, you have to prepare even more, because otherwise you get distracted in the exam by looking through your references. And as I said to you, you might, for a theory question, find an answer in your reference. But when it comes to your applied questions or your problem-solving questions, you're not going to find a direct answer in your open book. What you're wanting to use your open book for, or your references for, is confirming information that you're unsure about. You think you know it, but you just want to make 100% sure, and then taking that information and applying it or problem solving within your question. But if you don't even know which reference to start looking at to confirm that information, that's already going to be a problem. You're going to get yourself into a little bit of an anxiety state, because now you're going to be looking through websites and pages and references. Sorry, I say websites. You're not allowed to access websites, but the references on the online exam, you're going to be paging through those. You're going to look through your notes, and you're going to get yourself into an anxious state, and that's going to ruin your exam. So you do need to prepare ahead of time, study for your exam, make sure you've covered everything that the ELOs require, that the assessment criteria require, in line with your scope of practice as a post-basic assistant. Okay, then you need to know what to bring to your exam, how the online exam works, and how long the exam is. Now, Council do allow you to write, or you have to actually write, the practice exam to qualify for the actual external integrated summative assessment. And you need to use that opportunity to make sure that you fully understand and comprehend how the online system works, and that you have got all the resources that you need to be able to complete the exam. And then, as I said, how long is the exam? Well, it's 4.5 hours long. So you're probably going to need to arrange, if you are working, you're going to probably need to arrange leave for that day to be able to write that exam. Okay, so tips for preparations. You need to use the latest reference material. I'm not sure who's listening in and when last you did your post-basic course, whether you did the old course or the new course. I don't have that information, but you do. So you know that if you qualified 5 years ago, that some of that information might be outdated, and you need to go and look at the latest reference material and make sure that the information you have is the most updated information. Make sure that you are aware of some of the current and latest developments, what's happening in the news in terms of current events, pandemics, epidemics, what's happening locally, what's happening globally. You know, is there a measles outbreak? Is there a cholera outbreak? What's happening? Because you probably find then that there could be a few questions linked to those current events and latest developments. I've already mentioned that you must use the latest reference material because your course notes may be irrelevant or outdated. And then familiarize yourself with your reference material. Make sure you know how to use an index of your referencing. Make sure you know what the table of contents is. When you read the question, make sure you understand the question well enough to know exactly which reference source to go and consult. But if you've got 10 reference sources and you don't know which reference source is the right one for different sections, then you're going to get yourself into an anxious state. Never try and use a new reference in the exam. So all the references that you have for your exam, make sure that you know what those references are, that you have been through those references, that you understand what the information in each of those references is referring to in terms of the ELOs. You can learn from your work environment using standard operating procedures, because many of the standard operating procedures are based on GWDP, on GMP, and on GPP. And then if there's something that you don't understand, ask assistance from your colleagues or supervisors beforehand, not during the exam. You can't do that. But beforehand, while you are preparing, make use of your colleagues and supervisors to clarify questions, etc. So I'm going to take a break. You've heard my voice for long enough, and I'm going to hand you over now to Mrs. Barry.
Good morning, everybody. Okay, you can see my face quickly and then I'll go away. Hello and welcome to our training session, or our, whatever you want to call it. Thanks very much, Dr. Fogarty. I'm going to take us through the calculation section. So just a little bit of background about the calculations, and then we're actually going to do a few examples, and I'm going to work through all the examples with you. So let's go. I hope you're ready. Okay, so the distribution of calculation questions, you've already heard Dr. Fogarty talk about the ELOs, and she's described the ELOs in general, and you also heard her referring when there were calculations in those ELOs. So the three ELOs are the really big ones. We've got ELO1, that has got 33% of the calculation questions in total. ELO, the yellow one, ELO4 has got another 20%, and the orange one, ELO2, has got another 20%. ELOs 3 and 5 are the smallest sections with only 13% of the calculations within those sections. So I'm going to go through each of those sections now with you. Okay, let's see. Okay, so in ELO1, you will get some basic scientific calculations like conversions, dilutions, formulations, possibly asked to calculate an appropriate dose. So that's very important. Reconstitute dry powders to the appropriate concentration, antibiotics. So you might be asked to do that. That's ELO1. In ELO2, that's all about stock management. So here you may get questions that ask a minimum, maximum orders, reorder levels. Dr. Fogarty mentioned some of the examples as well, and we will look at a stock consumption question in our examples. So possibly stock consumption, average monthly consumption, calculating lead times, reconciliation calculations in stock management, cost, value of stock. All of that falls under ELO2. So ELO3, manufacturing, packaging, and repackaging of non-sterile medicines and scheduled substances. Here you will be asked to do calculations on solubility, stock consumption, master formula, reconciliation calculations in packaging operations, and possibly to calculate an expiry date on a product that is formulated. ELO4 is the compounding, manipulation, and preparation of non-sterile medicines and scheduled substances. So this is your extemporaneous compounding. So these tend to be some of the more difficult ones. So it's really an area that you can focus on when you are doing your preparations, to calculate quantities of ingredients according to formula, reconciliates calculations in repackaging, ratios, all of that kind of thing. EL05 dispense prescriptions and cell schedule 0, 1, and 2 medicines. So here you'll be asked to possibly do a dosage, maybe calculate the amount of medicine required for a prescription. We'll also do a couple of examples on that. And here as well, possibly to convert from milligrams to grams or the other way around. Okay. So the recommended textbooks for calculations are the Pharmaceutical Calculations by Ansel or Winfield and Ida Fiago. Sorry, I probably said that wrong, the 4th edition, Calculations for Pharmaceutical Practice. Also Winfield, Rees and Smith, Pharmaceutical Practice. So just very important that these textbooks really are the same as what Dr. Fogarty mentioned. You're not going to be able to find the calculation answer in these textbooks. The questions were not directly taken out of a textbook. They are calculation questions, so you might find something similar. So it's very important that you're not trying to look to how to do a calculation. The calculations you really need to know how to do before. You've got your notes, make your notes on how to do calculations, make your notes on some basic calculations from each of the ELOs so that you've got a nice platform to practice on. Be mindful of time, searching for a calculation, rather come back to it. If you have to go look in the textbook, don't spend half an hour looking for it. You really only have a very short time to work on that calculation question. The other thing with the textbooks that's very important to remember is that not all calculation types may be applicable to the exam that you are writing. So, for instance, okay, you guys, post basics, technician basics, all different type of calculation questions. These pharmaceutical practice, these textbooks are also written for pharmacists. So it's not aimed specifically at the pharmacy support personnel. So you don't want to go and get yourself into an absolute panic state looking at these questions and thinking, how on earth are you going to remember that? So remember the scope of practice, remember from where you've studied, go and look at how far you need to go with the calculations. So don't get into a panic by looking. It's good to look for examples like on conversions, that type of thing, and any type of examples, but remember within your scope. Okay, some tips to remember when you're doing the calculations is to understand the principle and not to try to memorize the calculation, because as you know, in any of your previous maths exams at school or any kind of calculations in your studies that you've done so far, 99%, 99.9, it's not going to be exactly the same. So you really need to understand the principle and not just the calculation. What are the SI units? It's important to understand that if it's percentage weight per volume, in other words, it can also be written as grams per mils, grams per 100 mils. This is very important, and we'll do some examples as well. You have to remember percentage weight per volume means grams per 100 mil. Percentage volume per volume means grams per 100 grams. Percentage weight, sorry, that's weight per weight. Yes, weight per weight. Volume per volume will be milliliters per 100 milliliters. So make sure you've got that written down and you remember that and you understand it. Remember that you need a calculator. You can't borrow a calculator from somebody sitting next to you. You will not be sitting next to anybody. So make sure you've got a calculator. Make sure it's one that you've used before. I was in an exam invigilating yesterday at the university, and the student was asking me, ma'am, how do I clear this message on this calculator? So she obviously did not, that was probably a borrowed calculator, and she didn't actually know how to use it. So that you don't want to get into that situation. Make sure that you've used it. Check the batteries, maybe have a backup if you need to, know the settings, have multiple papers and pens, because even though it's online with your calculation, you will need to write down. Some other calculation tips are to select the correct formula. So when you, for instance, when you're doing your stock control, make sure that you've got the correct formula that you're selecting. Transcribing, I can't say this enough. I really can't. Double check against the question that you've used the correct figures in your formula. So make sure that when you are writing it down on a piece of paper next to you so that you can do the calculation, make sure that you've got the correct number from the question. Transcribing mistakes often throw you off. Obviously, in this particular case, you've still got 4 possible answers, so you might still get lucky. And when your answer comes up and it's totally different to the other 4, you know you've made a transcribing mistake somewhere or somewhere on your calculator. I always tell everybody to double check on their calculator to make sure, put it through a few times. If it's the second time, if it's the same, you can stop checking. If it's the second time different, check again and again to make sure you put the right numbers into your calculator. If possible, estimate a range for your answer. So this is logic. Will tell you, for instance, if you've calculated, if you're doing a prescription and it says take 2 tablets 3 times a day for 5 days, and you need to give the patients 250 tablets. You guys, a lot of you have, most of you have worked, you are working in practice, so you've done your practice, some practice, you will understand that there's very few prescriptions that you need to give 250 tablets. So go back and have a look. You've probably added a 0 somewhere. Use your logic to try to see if you are wrong with that answer. Yeah, I love the good one is grams and milligrams. If you go the wrong way and you look at, now you must give the patient 2 kilograms of medicine. Like, how can that possibly be? We can't give 2 kilograms. So maybe you went the wrong way when you did your conversions, which we'll show you now. So very important. Those are just a few tips. Practice converting between units. You think you know this, but just try to practice again and again and again, so that as soon as you look at, on the left-hand side, for instance, as soon as you look at micrograms, you know immediately that micrograms, there are 1,000 milligrams in 1 micro, sorry, 1,000, there are 1,000 micrograms in 1 milligram. You see how easily it can happen. So remember, when you are going from the left to the right, you're going to divide by 1,000. If you're going from the right to the left, you're going to multiply. So kilograms is going to be the least number, numerical number, where micrograms will be the most. Okay. Yeah, just keep practicing those. There are lots of examples. You can plug examples into your AI tools. You can ask for, give me 5 examples to practice this, that, and the next thing. Not during the exam, but there are lovely tools that you can create your own questions. Okay, so that's the one. The other one is obviously in your kiloliters, liters, milliliters, and microliters. The other, Dr. Fogarty also mentioned how much time you have, and it's probably a good idea, especially in your practice exam, where you're not under so much pressure, but you have basically 3 minutes per question. And this is your 30 multiple choices. These are just your calculation questions that I'm talking about. You've got 3 minutes per calculation. Some of the calculations will go much quicker. Some of them will not. Some of them will take a little bit longer. Some you might need to come back to. So if you see it's taking you too long, rather come back to that. Make a list of the questions that you need to go back to. Okay, you don't need to stress. There will be enough time. There is no negative marking, and rather don't leave anything blank. Take a guess the first time if you're not sure, but then make a note, go back and check that particular one. Okay, so that is all that I wanted to say there. If you now click on or use the link or scan the QR code, you will get taken to a quiz, a short quiz. I think there are 12 questions. And I'd like you guys all to practice these 12 questions. Go on, do them, submit your possible answers. If you're not sure, select anyone for the purposes of today. But these are really practice questions. We're just getting you started on it. So scan the QR code. I think I just want to check with the office. I think we've got 10 minutes for this. Is that correct? 10 minutes?
And that's correct. Yes, that is correct, Mrs. Berry. Thank you.
Thank you so much. Okay, so it's now 9:47. Let's say let's make it 10 o'clock. If I see most of the answers are submitted, I'll start a few minutes earlier. But let's say we're going to start at 10 o'clock and I'm going to go through each question and answer it with you. Thank you. Okay, I'm going to give you another 2 minutes. I see there have been 11 people have completed it. I'm going to carry on until 2 minutes past 10. Keep going. Okay, so let's begin with the first question that we had. The first question was, how many days will the following prescription last? And it was Glucomed, 80 milligrams, 112, and the instructions was 2 POBD, and it was for 1 mark. Okay, so the main thing, I think this 69% of you said that it was 28 days, and that is correct. Well done. That is the correct answer. Those of you that didn't get it correct, maybe just go over your instructions on the prescriptions, your abbreviations. So 2 POBD is 2 tablets per os by the mouth, in other words, tablets. BD is twice a day. So 2 twice a day, that makes it 4 per day. You've now been given 100 and the prescription said that we must give the patient 112. So what do? We say 112 divided by 4 per day, and that will give you the number of tablets the number of days that you can that the following prescription will last. So just to go over again, you will have a look. The prescription says give 112. You're using 4 a day, so it's 112 divided by 4, which will give us 28 days. Okay, so that one is generally well answered, but just those of you that didn't get it, please go over your abbreviations and your prescriptions. Okay, the next question was quite well answered. 75% of you said 14. Let's see if that's the right answer. A prescription is written as follows. Okay, I'm just going to switch over to my other screen because we can't always see. Okay, a prescription is written as follows. It's question 2 on my screen. Prednisone, 10 milligram, and then it says the prescription says 20 milligrams per os BID for 2 days, then 20 milligrams per os once daily for 2 days, then 10 milligram per os once daily for 2 days. For this one, it's very important that you go and you write everything down. Okay, so I think you can see my little screen here. I'm going to attempt to write, and excuse my handwriting. It really is not very good on these screens. So let's see first. We need the 10 milligram tablet. So the first thing that you need to make sure that you understand is 10 milligrams per tablet. Okay, that's very important. So first of all, we see 20 milligram per os BID for 2 days. So 20 milligrams This is how many tablets? 2 tablets. Okay. Times BID, how many times a day? So BID, that would be 2 times a day. Okay. For 2 days times by 2 equals, we're going to add that. What's 2 times 2 times 2? 2 times 2 is 4 times 2 is 8. Okay. Our next, let's just move this across so we can see. It then says 20 milligrams per hour daily for 2 days. So it's 20, which is 2 tablets, times once daily. So once daily times by 1. The next one is for 2 days, so times by 2. So we've got 2 times 1 times 2, which would give me 4 tablets. Okay. Then you see why you need a pen and paper. Then 10 milligrams per hour once daily for 2 days. So 10 milligrams, which is only 1 tablet, times once daily, okay, times 2 days, and that will give you 2. The total tablets we add up 8 plus 4 plus 2, and that will give us 14. Okay, well done to those that got 14. For the other ones, you can go back and have a look at this later, but that is the correct way to work it out. Rather write down as much as you can say, then you can see that you're getting it correct and you're not making any errors. Okay, let's see, go back to my other screen. Okay, so 75% of you got 14. Well done. The next one was not so clear. So let's see what was wrong here. 56% of you still got it right. So that is correct. 25% weren't too sure and 19% weren't too sure. So this is really we've got to look a little bit at our conversions and our cross multiplication. I love doing a cross multiplication. So let's see. A patient injects 8 units of U100 insulin each day. What is the volume in milliliters the patient needs to inject? So what do they want? They want the volume. That's the first important thing. The volume to inject per dose. Okay. They've given you a little hint here. U100 equals 100 units of insulin per ml. So U100. This is the same as 100 units of insulin per 1 milliliter. Okay, 100 units per 1. I can also write that down by saying 100. Oh, sorry, it's 100 units. 100 units in 1 milliliter. Okay, a patient needs to inject 8 units of this U100 insulin each day. What is the volume in milliliters? So the patient, now you write down, over here you write down, you want to know the patient's got to inject 8 units. So we do our little, this is how I always set it up. You may have been taught a different way. So please go, by all means, use your way, but I always do it like this. I've got this conversion. I know what I know. I put down first. 100 units equals 1 mil in 1 mil. Now I've got 8 units in, and I do my X mils. I then do cross multiplication. I say, okay, X times 100 equals 1 times 8. So I multiply that, and then I multiply the other way around. Okay, let's just go down a little bit. Then I want my X on its own. Over here, I want it on its own. So I divide this side by 100, and I divide that side by 100. So then I get X equals to 1 times 8, which is 8 over 100. And X is then equal to 0,08. Okay, and that is the correct answer. So I hope I've clarified that for you, for those of you that didn't get that answer correct. But keep practicing, practice some more questions like that. Oops, I don't know what happened there. Okay, let's go back to my screen and question 4. So 56 of you got that one right. Another common example is when we look at dilutions, and I actually think 60% is quite well answered here. So well done to those of you that got it correct, because this one is one of the more complicated ones. It is more applied. Dr. Fogarty spoke about LOC 1, 2, and 3, I think it was, or difficulty, I can't remember what she spoke about, but it is the more applied question. It is a more difficult question. Some of the calculations are straightforward and easy, some of them are more difficult. So this particular one, if 150 milliliters, okay, let's just scroll down here a little bit. What's going on now? Okay, if 150 milliliters okay. If 150 milliliters of a sorry, I just want to, this is not giving me any more space. Okay. If 150 milliliters of a 15% solution is diluted to a total volume of 300 milliliters, what is the percentage strength of the final solution? Okay, let's have a look at this now. The first thing I've got to look at is what I know. So I've got, and I sometimes do draw when I'm very bad at drawing, but imagine I've got a tub here. Okay, let's just, this is actually a bottle or a beaker. Let's say this is a beaker. Imagine 100 and this is 150 mils over here, 150 mils. Okay. And the strength concentration of this is 15%. Now, what do we know straight away about 15%? Very important that you know 15% is the same as saying, let's say, for instance, it's a solution. So something has dissolved into the liquid. So it's 15 grams in 100 mils. Okay, got it. 15 grams in 100 mil. That is what my 15% is telling me. You don't need that in the question. You've got to know that. So remember what I said about weight per weight, volume per volume. That's very important. Okay, so this is the start point where you could have gone wrong. Okay, that is diluted now to 100 ml. The way I would do this question is, how many actual grams do we have in this bottle, in this beaker? So we know we've got 15 grams per 100 ml, but actually we've got 150 mils. So let's say, how many grams are there in 150 mils? And X, we do our cross multiplication. I'm not going to write the whole thing out, but 150 times 15 divided by 100 will give 22,5 grams. But we're not finished yet. Okay, so this is the weight of solute that is in this beaker. Okay. If we know now, we need to take that volume of liquid and we now want to dilute it. So we're not going to add, so we now want to put it into another beaker. We're going to tip this all the way down there into another beaker. There's my 150 mils that I've taken across. And now we're going to dilute it. So we're going to pour in another 150 mils of liquid. Got that? Okay. So now we're going to pour in another 150 mils of liquid. We haven't changed the amount of drug in there. Can you see that? We haven't changed. It's a dilution. So now what do we have? We now have 22,5 grams in how many moles? That was in 150, but now we've added more liquid. So we've now got 22,5 grams in 300 moles. Okay. So what is our percentage final strength? What would we need to know? How many grams are there per 100? And everything per 100 is the equivalent to our percentage. So we've got to try and work this out. And we're basically going backwards again. So if we work it out, we do our cross multiplication. We say X times 300 and 100 times 22,5. Okay, so X will be equal to 22,5 times 100. And we divide that then by 300. Okay, that's our cross multiplication. I hope I'm not losing you. And we would then get that X is equal to, this answer would be 7,5, but now we've put it into a percentage. Okay, so this is probably one of the more difficult questions that you will get. And it's a good idea to practice this one as much as you can. But it is probably one of the more difficult ones. That's why I said actually the 60% answers is a good sign. Okay. Another question. If 24 grams of a medicine is mixed with 46 grams of base, this is a ratio question. Also, very, very good question. What is the percentage weight per weight of the preparation? So let's have a look again. Let's get to my little notepad. If we've got 24 grams, so we're going to start off, we're going to write down, let's see, we've got 24 grams of medicine. So 24 grams here. Okay, 24 grams of medicine. We mix it with 46. Here's our base, 46 grams of base. So we add these two together, 24 plus 46. This is our medicine, okay, our drug, and this is our base. How many grams are we going to get in total? We add these two together. This is going to give us 70 grams. Okay, our total weight of our medicine is 70 grams. The question is, what is the percentage strength, weight per weight of the preparation? Percentage strength, we normally look at our medicine. So what they really want is a ratio of the 24 grams to the total weight. So we say 24 out of 70, and we want a percentage strength, and we times it by 100, and we get our answer. You can also do this other ways. You can say 24 if we want, oh, sorry, I wrote 24. I wrote 25, 24. Apologies, that should be 24. You could also write it 24 to 70 as a ratio, but they really want it in the percentage form. So 24 divided by 70 times 100, our percentage would be 34.3%. Okay, and 50% of you got that correct. So well done for you. The others, it is we do find, and Dr. Fogarty will probably agree with me, we do find that the ratio questions are more are not answered as well. So practice as many ratio questions as you can. Okay, next question, I don't think we need to spend very much time on at all, but I'll quickly show you the question again. Well done. Give yourselves a hand clap for that one. Calculate the average monthly consumption AMC for enalapril, 10 milligram 28, if the stock card indicates the following usage. No complicated matters there. There were 6 months. You added the 6 and divided it by 6. So well done, guys. You got that correct. Excellent. 24 of you got it right. Just to say for this one, it's very important to remember that when you're looking at the different units, you may, well, the different types of questions that you may get a table with 2 different products that are listed on there. And for instance, it might be an enalapril 10 milligrams and an enalapril, or let's say enalapril 28s and then enalapril 56s, for instance. And you now need to give the average monthly consumption of the enalapril 28s. So be careful of make sure you read your question properly. Make sure you read your unit strength and your amount. This one is straightforward. There was only one possible unit that you could use, but you may find that there's a list, like at the end of a stock take or something, that there's different products that you need to look at and separate them, perhaps on expiry date or dosage strength or on the number of tablets per box. So make sure that you are aware of that. This was very straightforward, but well done on all of you. Okay, let's see the next one. Which of the following weight in milligrams is equivalent to 2750? Okay, so this is why we brought up the units and the conversions. So even after I did the conversions, we still had people not getting it correct. So this, make sure you do check and check and check again. Make sure you go and you have a look at micrograms going to milligrams. Okay, micrograms going to milligrams. For this one, you've got the correct answer should have been 2.75, so 63% of you got it right. There is 1 milligram for I mean, there are 1,000 micrograms in every 1 milligram. So that's very important. 1,000 micrograms in every milligram. Go back and have a look at that table that I showed you earlier on in the slides and make sure. This is just, I can't even show you. We'll go back to the slides later maybe, but just go over your conversions. Make sure that you know how to do that. Next question, if a prescription calls, and 75% of you got this right, so well done. If a prescription calls for 2¼ mils of a mixture 3 times a day, for how many days will 20¼ milliliters last? So 2¼ milliliters of a mixture for 3 days. 2¼ is the equivalent of saying, okay, let's write this down. So 2¼ is the same as saying 2,25 mils, and we multiply that by 3. And now what do we get? We get multiplied by 3, we get 6,75 milliliters. They're now saying how many days will 20¼ mils last? So this is how much we need to be given per day. So this is per day. Now they're asking how many days will 20¼ So 20,25 divided by the number of mils per day, 6,75, and we would get the answer as 3. So that those 20,25 will last 3 days. Okay, so practice this one as well. It's a good example. Next one, the dose of a medicine is 125 milligrams 8 hourly. If a vial contains 2 grams of medicine, how many vials will be needed for a 10-day supply? Now, perhaps you're working mostly in community sector, so you don't come across the vials so much. If you're working in hospital sector, you will probably have got this correct, or if you've got experience in hospital sector. But yeah, let's have a look through it quickly. I just want to make some more space there for me. Okay, so let's look at it. The dose of a medicine is 125 milligrams, 8 hours. So 125 milligrams, 8 hourly is how many, if I'm working out the per day dose, 8 hourly is the same as 3 times a day. Okay, correct, 3 times daily. So we've got 125 times by 3. The hourlies. Okay, 125 times by 3. So 8 hourly is every 3 hours. If it's 6 hourly, it's 4 times a day. If it's 12 hourly, it's 2 times a day. So make sure that you understand those. Very, very important. 8 hourly, 3 times a day. So 125 times 3, that will give us, what do we get there? 125 times 3. Got it? Hang on, it's 7. I didn't work it out now. 250, 375. There we go. I've done something slightly different on my notes. Okay, so we would have 375 milligrams that is needed per day. If the patient needs a 10-day supply, we say 375 milligrams times 10 days, and we would get 3750 milligrams. Okay, again, it's a conversion. This is what the patient needs for 10 days. In one vial, we get 2 grams. 2 grams is the same as how many milligrams? 2,000 milligrams. Now you can straight away see how many vials will you need? 3750. Can 1 vial be enough? No, you're going to run out. We need 3750, and we've only got 2,000. Will 2 vials be enough? Yes. So 2,000 milligrams times by 2 is equal to 4,000. And 4,000 milligrams will be enough for that dosage up there. Okay, so that's also quite a high level question, more difficult, and hence the answers there. Next question. How many milligrams of ibuprofen are present in 100 mils of suspension if there's 20 milligrams of ibuprofen in each milliliter? Okay, let's have a look here quickly again. So how many milligrams? Make some space. I'm writing a lot. Okay, let's see. How many milligrams of ibuprofen are present in 100 mils of suspension? If there are 20 milligrams in each mil, 20 milligrams in each mil. Now this, remember, you always write down what you know. What does it tell you? It's telling you there are 20 milligrams of ibuprofen in each milliliter. So 20 milligrams per mil, we write that down. Then you go back to the beginning and look at the question. How many milligrams are present in 100 mils? So this is what we're trying to work out. How many milligrams in 100 mils? So we're basically putting the question into a calculation form. I do my cross multiplication and I get 2,000 milliliters. Okay. Sorry, milligrams. Apologies. Okay. Let's write that out. Okay, great. Sorry about that. And the teachers make mistakes. Okay. Next up, I'm not sure if that was the final question. No, not yet. A prescription requires this is very well answered, I must just say, because these questions are often not answered well. So congratulations, guys. 88% of you got that right. So I don't need to spend too much time on that. Let's have a look. Just quickly go through it for those of you that didn't get it correct. A prescription requires a cream that contains salicylic acid, 5% weight per weight, made up to 500 grams. Okay, so we've got 5% weight per weight, 5% weight per weight. This is the same. Now we know this is what we've got. It's important to translate this into a digital or calculation form. So we know this is the same as saying 5 grams in 100 mils. Oh, sorry, 100 grams. There we go. Getting mixed up there. 5 grams in 100 grams because we're talking about a cream made up to 100 grams. How many milligrams would there be if you required to prepare 150 grams? So if we required to prepare 150 grams, how many grams of salicylic acid would we need? X is then, you would do your cross multiplication, X times 100, 5 times 150, and divide it, and you would get to 7,5. What are we doing? How many milligrams? Yes, 7,5 milligrams. Sorry. Oh, okay. I see what was wrong there. We didn't have a correct answer. 150 grams. No, that is grams. Apologies. Oh, you can see I need my coffee. Dr. Fogarty, I think it's nearly time for you to take over. Last question. Okay, 7,5 grams. Well done. So most of you got that right. The last question, let's see how that was answered, was what is the percentage weight per volume of iodine in iodine tincture if there's 4 grams of iodine in 200 milliliters? Okay, 50% of you got that correct. The correct answer was 2. So let's just quickly go over that as our last question. What is the percentage weight per volume? Back there. Okay, let's see. So we've got what we know. We know there is 4 grams of iodine in 200 mils. Okay, now the question is to take it to a percentage. What do we know about the percentage? How do we write a percentage? It's usually grams per 100 mils. So if we say here per 100 mils and we say X grams, if we can work out these X grams, that is the same as our percentage. Okay, so we do our cross multiplication. So it's really simple if you just remember that a percentage is grams per mils, or that weight per weight, weight per volume. Okay, that would then give us 2% is our final. So that was the last question. Well done, guys. Yeah, some of the questions answered really, really well. Some of the questions not as well, but understandably so. And yeah, I think that we eventually had 41 people. And I'm not going to go into each of the questions. You saw the number of answered. I think that we all need a break now. So I think that I will sign off. I think that was my last slide. And I think the next slide is a break. Is that correct, Nkotula? Is it correct that we've got a break now? And if you could just
Yes, I
guide
can
me on.
confirm, Mrs. Berry, we will have a break and then Dr. Fogati will continue. Thank you.
Okay. So what time are we starting again?
It will be at 10:41.
10:41. Okay.
Yes.
Thank you, everybody. Thanks.
Thank you. See you then.
Okay, good morning again, everyone. I hope you've had an opportunity to have a cup of tea or coffee. I am going to just cover the general questions section and give you an opportunity to answer some questions from the general section. I'm going to turn my camera off. Okay, so if we look at the general section blueprint, the distribution is across all 5 of the exit level outcomes, with a majority of questions coming from that ELO1, which was the basic scientific principles covering everything from scope of practice, legislation, code of conduct, pharmaceutical terms, anatomy, pathophysiology, Schedule 0, 1, and 2 medicine, so quite a big section. And then ELO2, which is your stock section, is 13%. ELO3 is your manufacturing, 16%. ELO4, extemporaneous compounding, 13%. And then ELO5 being your sale of Schedule 0, 1, and 2 medicines. Okay. This is a list of references or some examples of references that you can use in pictures. Martindale, the South African Medicines Formulary, MIMS, the Essential Medicines list and standard treatment guidelines from the Department of Health. You are allowed to use books. You are allowed to use PDF copies that have been downloaded or printed. And then the online references being referred to in the slide are the online references that are available on the exam platform. You can't just go to any website and go and find a reference during the exam. Okay, so if you do want to use PDF copies of resources that are on websites, you need to download those prior to your exam. Make sure that your references are applicable to the South African setting and that they are the most up-to-date references. Just continuing in terms of the types of references that you can use, I've already mentioned the standard treatment guidelines and essential medicines list. All 3 levels can be used: primary healthcare, pediatric, and hospital. Your good pharmacy practice manual and associated rules, those can all be found on the Pharmacy Council website, and I will show you in the next slide where to access them. Your GMP guideline, that is on your SAHPRA website. And then obviously the acts and regulations linked to the acts, and the Medicines and Related Substances Act, and the regulations and schedules of medicines linked to that act. Right, so if you want to find the Pharmacy Act and the legislation linked to the Pharmacy Act on the Pharmacy Council website, you will go to the council website, and you don't even have to log in. You can just click on this middle icon here, the one that looks like a book. And when you click on that, it will bring up these additional icons: the annual reports, legislation, pharmacy, rate card, and reports. And then I think you can see what you're going to click on next. You're going to click on the legislation, and then the legislation will show you you've got the act, which is the Pharmacy Act. And then if you click on regulations, all the associated regulations will come up. And then keep going, you click on the rules, all of the rules will come up. And these are all in PDF downloadable format. There's also board notices that are available. And generally, we're not going to ask you any questions on proposed legislation because it hasn't yet been signed in as legislation. And so that's why we're not going into the proposed legislation tab. But acts, regulations, rules, and board notices, all of those documents are published. And so we can ask you questions from any of those. Again, don't be like overwhelmed by the number of documents. Think about, what is my scope of practice as a post-basic assistant? And so which documents are going to be relevant for me to look at as a post-basic assistant and related to the exit level outcomes and the assessment criteria that we have already shown you. We've spoken previously about the books, making sure that you know how to use your reference material, that you're familiar with your reference material, you know what information is in each of the reference material documents. So, and how to use the index of your reference source, especially if it's a book. More references is not necessarily better. If you remember earlier, I said to you, sometimes you get distracted by paging through too many references, causing anxiety. Well, the more references you have, the more pages you're going to be paging through, the more anxiety you're going to have. So rather use the minimum number of references required to successfully cover the material that you need to know. I've already also said avoid using any reference books you've never used before, and using your notes from your provider may help, but they also may be outdated. And so you have to think carefully, is this something that is a foundation that has never changed? Is this something that could easily change? Legislation, for example, changes on a regular basis. So you need to look at the most recent publication of legislation. Familiarize yourself then with the online references, and the office will go through those online references with you just now so that you know exactly what is available on the exam platform. And then any other references you need to download before the exam, because it's very time consuming to search during the exam, or to try and download the ones from the online system during the exam. And I've already spoken about the Pharmacy Council website and the SAHPRA website in terms of finding documentation. Read your questions carefully and identify the statements of which you are sure. Okay. With multiple choice, it always works like that, because you get distracted, and that's exactly why they're called detractors, is because they distract you from the correct answer. So my way of answering multiple choice questions is not to look at any of the answers, is read the question first and answer the question in your mind, or write down what you think the answer should be, and then uncover the 4 options and you see which one matches your answer most closely. And then confirm the statements you are unsure of. So that's when you use your references, just if you want to confirm something. And you don't have to do that for every question. If you are sure that you know the right answer, then don't go and confirm it in a reference. You're only using your references for those questions that you're unsure of, and you just have you just want to confirm something. And then if there's a question that you don't understand, or that you're unable to answer immediately, you can continue to the end of the exam, and then you can go back to that question at the end of the exam. Okay, so don't feel like if you're feeling like I really don't know this answer, rather move to the next question and come back to that unknown question at the end of the exam, because maybe by that stage you would have thought about the answer. When we ask questions, we try and avoid these negative statements. But if there is a question that comes across and it says, which of the following are correct, or all of the following are correct except, then you're looking for the false statements. But we really do try and avoid asking those. But make sure we also try and highlight those words that affect the question, like except or false or not or incorrect. Most of the time our questions are based on true or correct answers, but we might still say which is the most appropriate, and then most will be capitalized, or which of the following is true, and then true will be capitalized, just to try and draw your attention to exactly what we are looking for. When we ask a question about most appropriate, those are sometimes the trickier ones, because there could be one very correct answer and then another answer that is possible but is not the most appropriate. And so you really need to think through that and consider the question again, and exactly what the question is asking, and which of the answers matches the question most closely. Right, and then in terms of managing your time, you've got 3 minutes per question in your calculation section, and then for this section, you've got 2 minutes per question. And so your time is 180 minutes and 90 questions, 4 options per question, and therefore approximately 2 minutes per question. We also do not employ negative marking, as I've mentioned before, and so don't leave anything blank. If you get to a question and you're just a little bit, you kind of think that that's the correct answer, but you're not 100% sure, rather mark it as the correct answer, because you're not going to get negative marks. Okay, right, and now we've got 10 questions for you from the general section for you to answer. So again, you can use this link or scan the QR code, and we will give you 10 minutes to answer those questions. It's currently 52 minutes past 10. Hopefully, by 2 minutes past 11, we can continue. All the best. Sorry, candidates, I just, the first link that was posted for the general section is not the correct link. Can you please go back into the Q&A and you will see that there is another link posted there that says general post basic EISA, fill out the form. That is the correct link. The first 3 questions will be the same as the ones you've already answered, but there are 7 more questions there for you. So we're just going to give you a few extra minutes because you've had to switch links. We will come back to this at 11:10. Right, I can't delay any further because we still have to get through the presentation of the online exam system. So I've got 20 responses. You can keep answering as we go through, but I do think I need to start just going through the correct answers. Yeah. Okay, so for the first one, we've got seems to be a seemingly easy question. Which of the following measures will be most effective to ensure that temperatures in a medication storeroom remain favorable for the storage of medicines? And so painting the walls black, okay, no one answered that correctly, thankfully. Installing heaters, also, no one answered that, so that's good. And then leaving the windows open, well, that may allow some air circulation and it could possibly create some airflow, but the correct answer then is installing air conditioners to regulate temperatures. So everyone got that one correct. Let's just look at the next question. Sorry, I just have it in my head that I might be on mute. So I just want to double check that you can all hear me. Yes, you can. Okay, great. Right, so next question was, when completing a store's requisition form, what information should be filled in accurately? Now, a store's requisition form is a form where you are ordering, maybe you're working in a dispensary and you need to order from the medicine store. What do you need to fill in so that the medicine store knows what information to send you? So what's important in this particular document is the store needs to know what they must send you. Okay, and so the information that's required for them to be able to fulfill the order is to know the unit of issue and the quantity required. Okay, so they don't need to know the average monthly consumption, they don't need to know the lead time for each item, and they definitely don't need to know the driver delivery details. What stores need to know on the requisition form is what medicine you want, in what unit, and how many of them. So the correct answer for that one is B, unit of issue and quantity required. The third question is linked to scope of practice. Okay, so a pharmacist assistant post basic under the indirect supervision or under indirect supervision of a pharmacist is required to reconstitute a Schedule 4 antibiotic. Which statement is correct? Okay, so Schedule 4 antibiotic, you're working in a clinic, you're under indirect supervision, a prescription comes in a clinic book, and you now need to dispense this medicine. So, which statement is correct? A pharmacist assistant post basic may only perform this activity under indirect supervision in a primary healthcare facility. Okay, so that is key because primary healthcare facility is not actually in the question. So you having to identify that, yes, indirect supervision, I can only work under indirect supervision in a primary healthcare facility. It's the only time that a post-basic assistant may work under indirect supervision. Secondly, a pharmacist assistant is not permitted to work under indirect supervision. That's incorrect because you are permitted. Only a pharmacy technician may perform this task under indirect supervision. Also not correct. A post-basic assistant, if you go and look at the practice regulations, a post-basic assistant may work under indirect supervision in a primary healthcare facility. And then the last one, a pharmacist assistant post-basic must phone the pharmacist to obtain permission to do the reconstitution. So do you know what reconstitution is? That's a place to start. It's just adding the distilled water into an antibiotic powder to make it up to volume to be able to dispense it. So you're not actually doing any kind of compounding. Really, you're just doing reconstitution, and you know, it's not a task that needs the pharmacist's permission to be able to do. That is something that a post-basic assistant can do under indirect supervision. Right, the next question then, also linked to scope of practice. A pharmacist assistant post-basic is asked to prepare a chemotherapy infusion. Which statement is correct? So without looking at the answers just yet, think to yourself, what is a chemotherapy infusion in terms of, where it would be available, what kind of preparation is it? And so it's chemotherapy, it's cancer treatment, it's going to be in a specialized unit, most likely in a hospital or in a facility that specializes in treating of cancer patients. It's also a sterile preparation. Okay, so it's not within the scope of practice of a pharmacist post-basic. Can you work with sterile products? Can you prepare the chemotherapy infusion? Yes, of course you can. Of course you can. It's a sterile preparation and you can prepare the infusion under direct supervision. So it may be performed, but under the direct supervision of a pharmacist. It is permitted under indirect supervision. Okay, none of you answered that correct, so that's good. And only personnel with additional permits may reconstitute cytotoxic medicine. Also not correct. So I think those of you that said it's not within your scope of practice, I'm not sure what confused you. Maybe you weren't sure that chemotherapy, you just thought chemotherapy is cancer treatment, so you can't be involved, but you can be involved. You need to be appropriately trained, and it must be performed under the direct supervision of a pharmacist. Okay, so here's just a plain definition. What does the term indication refer to in a patient information leaflet? And the definition is that the main condition for which the medicine is being used is the correct answer. How the medicine works in the body? No. Negative effects that arise from taking the medicine. How the medicine works in the body, that's going to be linked to your pharmacodynamics or your pharmacokinetics. It would suit one of those, or pharmacology, that would be one of the more appropriate definitions. The negative effects from taking the medicine, well, that's going to be an adverse effect or a side effect. And the time at which the medicine should be taken, and that's got to do with your dosage instructions or your frequency. If you hear the word frequency, that's about the timing. But indication refers to the main condition. Which of the following medicines is an example of a non-steroidal anti-inflammatory? Now we're starting to look at ELO1, maybe it's also ELO5, because ELO5 is the scale of Schedule 0, 1, or 2 medicines. Okay, 88% of you answered that correctly. Ibuprofen is a non-steroidal anti-inflammatory medicine. Good, I'm glad to see this is correct. Who's been into a community pharmacy and not seen chocolates on the counter? So this is actually a fairly new board notice that was published in the last couple of months, which is why I put the question in there. They talk about electronic nicotine delivery devices. I just used the term vape device. But yeah, your nicotine delivery devices may not, your electronic nicotine delivery devices may not be sold in a pharmacy. So well done. Okay, another definition. Which statement about sublingual dosage forms is correct? And this is about where we place a sublingual. Yes, it goes under the tongue. The buccal placed inside of the cheek is called a buccal tablet, and it's swallowed whole without chewing or crushing is your slow release or your specialized release tablets cannot be chewed or crushed. And then what's bonus point here? If it's dissolved in water before taking it, what is it then? It's then a effervescent tablet. Okay, oh, this is an interesting one. Okay, so this takes a little bit of problem solving, and you might need to use your reference sources to answer this one. It says, if the directions on a prescription are SIG, which means give Ponstan 500 milligrams PR Q6H PRN, what dosage form should be dispensed? Now it says PR, and that should be the clue. PR means per rectum. And so the correct answer here is suppository. And then which of the following oral antibiotics can be given to penicillin sensitive patients? Again, this one might take a little bit of thinking. So obviously amoxicillin, immediately you need to cross out because the patient is penicillin sensitive, which means that they could have an adverse reaction. So you don't want to give them amoxicillin. Cephalexin is linked to or related to penicillins, and so there could be a cross-sensitivity reaction. So that is not the safest one to give to a penicillin-sensitive patient. And clavulanic acid is not an antibiotic on its own. It needs to be combined with the penicillin for it to exert its action. So that makes those three incorrect, and then the correct answer there is erythromycin. And that brings us to the end of the general section. And I am going to now hand over to the office to continue.
Thank you, Dr. Fogati. I will take over now. Hey, afternoon, everyone. We have 38 minutes left, so I'm just going to try and make sure that we cover as much as possible and also address any burning questions before the end of the session. So I'm just going to take you through the remote online examination. As you're all aware, we do not have any physical writing. Even if you're writing at the office, at the SAPC offices, you'll still be writing on your computer. So just to take you through the requirements, preparing your equipment, and also look at eligibility to writing the EISA. So the first part that we'll go through is the eligibility criteria. So if you are registered in any of the three criteria, pharmacy assistant, learner, post-basic under the occupational certificate, the requirement is that the learner should have completed, and I do apologize, 12 months training with an accredited provider, successfully completed the knowledge, practical, and work experience module, received the statement of results. So you do not submit the results to the office. The provider will have to upload this on our website. You should have completed the practice EISA, which we will share details later, and also then book online to write and pay the applicable fee. If you're currently registered as a qualified pharmacy assistant post-basic, the requirement is that you are active and meet all the requirements for a qualified post-basic pharmacy assistant. You should have completed the practice EISA and booked online then for the EISA. If you are a pharmacy student, you should have been registered as a learner post-basic former BPharm student and completed for 400 hours in an approved pharmacy and under the direct personal supervision of a pharmacist, submitted at least one progress report, completed the practice EISA, and also booked online for the EISA and paid the applicable fee. So how do we go about making a booking? So all bookings are done online. So you don't have to send us an email or call the office or come here physically. You go online, log in onto the secure site, and on the dashboard, then you go under examinations. And then once you've clicked on the examination tab, go under examination booking. And you should see the screen. So if there's any outstanding criteria or you do not meet the criteria for booking, you will see the top part. Let me try this. Yes. Just okay, all we can see on the screen, you should see this top part where it will say your qualification is not being achieved. So that means that the provider hasn't progressed you from your current registration, or if you didn't write the practice exam. So these will be the warning for you to clear before you are able to book. But if you do not see any warnings in terms of why you can't book, you should be able to select the venue for both the calculation and the general section. Once that is done, you will be directed to this page where it shows the venue that you have selected and then the fee that will have to be paid. And you will click then on the book examination to continue to the payment section. So there's 3 ways to pay for the booking fee. You can either use the credit if you have available credit on your account, you can use that, or you can use a card, whether it's a Visa or MasterCard, you can select that, or you can use the SID option, which will be redirected then to your internet banking facility to be able to make a payment. So just before I move here, if you select, in the case you select a card or you select the SID option and it is unsuccessful, the booking will remain pending on the website. However, later on, then you will receive an SMS indicating that the booking failed, and then you will have to try again and book online. So in terms of the preparation for the examination, please always make sure that your details are current, because the office will always communicate with you based on the information that you have captured on the system. Make sure that the cell phone number is updated. If you had changed your cell phone number, the email address is also updated, as well as your profile picture. Why it's important to update your profile pictures? Because during the examination, if you're writing at the office or you're writing from home, the invigilator will compare your current profile picture with what we're seeing. So they should always match it, as well as the proctoring system, but I'll show you how that happens. As I said, the notifications are always through email and SMS when booking. So make sure that the details are current and updated. So where do you find the EISA manual and the practice paper? I am going to just make a disclaimer. If you go today or now to our website, you will not have any access to either the manual, the practice papers, because we are in the process of updating for post basic. What you will get is for basic. So just give us until next week, Friday, for all the information to be updated on the website. But to access such information, you will go under registered person, under the learner trainee tab, and then this is where all the information will be saved. In terms of the remote examination, we have 4 possible venues that will be applicable when booking. So you can either write from your place of residence, you can write from your workplace, or if you choose to come to the SAPC offices, you can select that. And there's also other options such as the library, which you can choose. And I think this was covered before, but I'm going to just reiterate. It's important to treat the remote examination as you would with any other examination. So if you're going to write from home or from your workplace, make sure that you find a quiet and suitable place to write at, where there's enough space for the devices and your reference material. You have to make sure that you download any electronic references before the examination, so that you're not inundated with now a lot of tabs as you're writing and unable to complete your exam. Please keep calm. I know it might be difficult, just like any other examination, but when you're writing, you have to keep calm. You will have the option to communicate with your remote invigilator if you're experiencing any difficulty. We can communicate on a cell phone, but you also have an option to communicate directly on the invigilation system, which is called the proctor. Ensure that you have your equipment ready. This has been covered before. So even if you're writing here at the offices, we do not have any extra calculators to lend to you. So make sure that you have your calculator paper for working out your calculations and so forth. In terms of the devices and connectivity, this is very important. If you have your own computer, or if you're going to ask someone to lend you the computer, or you're working from your workplace, make sure that everything is tested before the day of the exam. So what we need is the laptop or computer where you're going to write, and you'll also have to have your cell phone with the capability for QR scanning, because that would connect you to the exam. The device must have a camera or linked camera with video capability, and your connectivity minimum should be 3G. And in terms of the browsers, these are the 3 recommended browsers for writing the exam. Any other browser may not be supported. So if you don't have, make sure that you download before time. So that's Google Chrome, Firefox, or Microsoft Edge. So for those people that are using Mac products where the option is the Safari, download any of the three options, because the Safari is not compatible with the writing of the exam. As I said, it's important to make sure that you update your profile picture. So the image that you have on the SAPC website must be a color image and taken at least within the last 6 months. And you should cover the head and shoulders, so don't have a full profile picture. It's just important to have your head and shoulder covered. Profile picture then will be used by the invigilator to verify the identity during the exam. Okay, and how to update your profile picture. You can log in onto the SAPC website, and once you logged in, you can go under your personal profile then and update if you need to do that. And where do you fund this examination? Before they practice the EISA or the EISA, we will send you information on how to access, but it's always important to know that beforehand, because once you're anxious, sometimes it's just difficult to go through a lot of information. So if you want to now practice and check this before time, you will go to the SAPC website. You don't need to log in. You just go to registered persons, and you will go under learner, student, or trainee. Then go under assessments, and then the date for the upcoming exam will be reflected there. So if it's a practice EISA, you will see, it will say practice EISA. If it's a EISA, then you will see there, then you will have the option to click and access the exam. Then that's when you will log in. So day one of the examination, and this is just, I think it has been covered, that is the total, the paper is 120 questions with 1.5 hours dedicated to the calculation and 3 hours to the general session. So day one of the exam, you will need to log in at 8 o'clock. Even though the exam starts at 9. This is to make sure that you are able to access the exam, and should you experience any challenges, then you can communicate with us before the examination commences. So we recommend that you log in at 8 o'clock. Then you get the OTP, complete the declaration, and read the examination rules before 9 o'clock. At 9 o'clock, the examination will start. The exam will be invigilated through remote proctoring system, which will have a continuous video feed. So even though you're writing at home, we will be able to see you throughout the exam. And the first part of the exam will end at 10:30. That will be day one. And then day two, the same, you'll log in at 8 o'clock. Exam will start at 9 o'clock and end at 12 o'clock. At the end of the exam, then you will have to complete the post-examination survey. Now going to the examination platform. So once you've accessed the exam through that part where you go to the assessment, you will enter your username, which is your P number, the ID number or passport, as well as your password. Once you have entered those details, you will receive a one-time PIN, which is valid for 10 minutes. This OTP will be sent to your cell phone number and your registered email address. Make sure that those details are updated, because if you don't have updated information, then it means the OTP will be sent to a number that doesn't exist anymore. So once you have managed to enter your OTP, you will now be taken through the proctoring system, where there will be checks done on your equipment, and then you will access the declaration. So if everything goes well, that your computer is checked, connection is checked, your camera, everything goes well, you should be able then to go and access the exam and go through the exam. The time allocated will always be displayed. So once you start the exam, where you have 1.5 hours, you will see the time decreasing from there. So you can work around how you answer your question based on the time allocated. So steps on logging in and accessing the examination platform. It's important to follow the rules. So like I said, to access the website and the secure site for any other reason, you log in directly from the landing page. So if you type SAPC website you will see this, you can log in. But for the purpose of the exam, you don't log in from the main page. You follow the rules. As I said, you go under registered person, learner, assessment, then you will click on the exam for that applicable date. Enter your details, as I said, the P number, ID or passport, as well as your password. Then once you've entered and submitted, you will receive a one-time PIN. You will enter the one-time PIN, and then you will be taken to your equipment check. It's important to do this check before the exam, as I said. So we will save this presentation online. You can go to this link anytime to just check your device. And it's important to also do this check the day before the exam to make sure that the browser is working. And the recommended browsers, any of those, you make sure that that works. Your computer webcam should be turned on. Most of the people turn their webcam off for any other reason, but during the exam, you have to make sure that the webcam is accessible. The microphone is also accessible. There will be a network check to make sure that your connectivity is stable, and then the screen check as well. So once the equipment check is successful, all these will appear green. But if any of them do not pass the check, it will remain red until it has been sorted out and access is granted. So once the profile check is done, you just press next, and then there will be a verification of your profile picture. If this this one passes, then you can click next, and then you will need to connect your phone to the exam. How you do that, then you use your QR code capability on your phone to scan the code that will be on the screen. Once you've scanned the QR code, and everything's successful, then you will be able to be directed to the declaration. So once the declaration is done, you're able to continue then to the rules of the examination. And once that is read and understood, you wait until the exam start, which should be at 9 o'clock. Should anything change or there are issues, the communication will always be sent to your cell phone or to your email address. And at the end of the examination, as I said, you will be directed then to the examination survey at the end of the examination. And these are just the important messages that you should look out for should you experience any challenges when you're logging in. So if your time on your device is not aligned, so it should always be Pretoria, Harare. So if, let's say, you're writing outside of the country and you have a different time setting, you have to adjust it to the one that we have. If it's different, then it will be, you won't be able to continue. You'll get this error message. And then if the proctoring is not connected, you get this message. Proctoring, it means that there's connection with your phone as well. If you're not connected, then you will get this message. Then you'll have to rejoin and then scan and continue. And if you try and start the exam before the time, you'll get this error message that it hasn't started, but once it's started, then you will get this message. Okay, this has been covered, but important to note is that there's one question per page. Cannot select which answer to answer first because the whole paper is randomized. So if you're sitting directly next to another person or another candidate, their number one will not be your number one. So all these questions are randomized and cannot be changed. And this is the timed examination, as I said, for paper. The day one is 1.5 hours for calculation section, and for day two, that's 3 hours for the general section. You cannot revisit any question that has been answered. You can only go back to those unanswered questions. And always go for the single best answer, and this has been covered. You have to make sure that you avoid these violations during the exam. So if you try and access Google or AI to assist you with the paper, that will be considered a violation. So any action undertaken by the candidate to gain any unfair academic advantage will be considered a violation. This may include, but not limited to, cheating, copying, as well as possession of unauthorized material. But should you, maybe I'll make an example, try to access Google during the examination, your invigilator will warn you that you're not allowed to access Google during the examination. But if you continue, so this will be recorded as a violation. Okay, now going through the frequently asked questions. So where do you get help in the case where you have challenges? So we do have a chat function. So you can type your question in the chat function and your invigilator will respond via that chat. We also have the WhatsApp option. So the details or the number for the WhatsApp will be shared with the materials before the day before the examination. So you can send a WhatsApp message as well to your invigilator. It's important to keep calm. The invigilator will respond to your message. Remember, if let's say 40 of you are writing, we can't respond like within a minute because it's 40 people, or maybe let's say 5 people are experiencing the same challenge. So you just allow time for your invigilator to come back to you. But if the invigilator needs to contact me, as I said, it's very important to make sure that your contact details are current, because we will use the cell phone number that is on your profile to contact you. So make sure that your phone is fully charged and you have data for such communication. The invigilator may call or send you a message on the cell phone number you have provided to SAPC. So make sure that you update your details to the current. And what if you experience load shedding or loss of electricity during the exam? Important again to keep calm. So we advise that you check your shedding schedule before time. But should that unplanned load shedding happen, you will have to make alternative plan. Ensure that your laptop is fully charged before the examination. Make sure that your laptop is charged before the examination, and ensure alternative Wi-Fi connection if you're using a fiber connection. And if you're unable to find an alternative Wi-Fi connection or need to be connected to a power supply, please find alternative location. But you must always do that after you've notified your invigilator of such changes. If load shedding occurs, any answers that you've provided or any questions that you've answered will be saved automatically. So you don't need to worry about losing the work that you've already submitted. What happens to the questions you have answered if you lose connection? As I said, all the questions will be saved, so you don't need to worry about that. When you log in again, you will only have access to the questions that you have not answered. The questions will be randomized, as I said, and they may be renumbered on reconnection. So you won't see the same number one as you did before. So you just have to continue where you left off. What should I do if my invigilator notifies me that they cannot see my cell phone view during the exam? What you do then is just to open your QR scanner functionality on your phone and scan the QR code again to ensure that the phone is connected to the examination platform. What should I do if I need to change the exam venue? Important is that you always communicate beforehand. So if you had selected your workplace and then something happens, you want to now change to the SAPC offices, you can just send an email. We will respond to the email, but you can access then the booking letter on your profile. What should I do if disconnected and on login, there's a message that pops up to say that the page was open before? Advice is that you close all the browsers, delete any browsing data for the last 24 hours and then log in, or just change a browser and they should be able to access the exam again. Where you sit is very important. We can't stress this enough. Images are taken of candidates throughout the exam. So if you're writing at home, please don't sit on your bed in your pajamas, because like I said, it's an examination. We will be seeing you sitting on your bed. So try and make sure that you're presentable, just like you would if you're going to write at the office. Ensure that there's sufficient lighting, for example, close curtains or blinds if sitting in front of the window, because light can interfere with the picture. Test the lighting beforehand, take a selfie of yourself to make sure that what you're seeing is what we will see at the time of the exam. Ensure that your camera is on. If your device camera is always off, but on the day of the day before the exam, please test and make sure that it is turned on. Dress appropriately. As I said, images are taken to form part of the permanent record, so you don't want us to see. If the invigilator cannot see the images taken, they will phone you on your cell phone or send a message on the chat option. So make sure that you do respond to your invigilator and follow the instructions given. When will you receive your results? Can you view your results, your exam paper? Can your examination be remarked? So the first part is that the examination results will be released once they have been analyzed and verified, and this takes a minimum of 8 weeks. So that is important to note. So as soon as the examination results have been released, you will get communication. But I'm just saying, if you've written the exam this week, you're not going to get the results next week because there's a process to follow. So minimum it's 8 weeks. You may apply to review your examination, but you'll need to complete an application form and pay the applicable fee to do that. You will be allowed to view the examination question and the answers provided. The correct answer will be indicated as well. You may ask the facilitator for the reference or steps to the calculation, but you are permitted to make notes. However, you may not take photos or make copies of that examination. You may not apply for a remark. The results have been checked and verified. Like I said, it takes 8 weeks to make sure that everything is done correctly. The results are analyzed and verified. So by the time you get your results, those steps would have been done already. Okay, so should you have any questions or you want to clarify something, this is the email address to the EISA department. It's psp.eisa@sapc.za.org. We try our best to respond to everyone, but please don't send emails without any context or reference. So if you want to ask if you qualify for the exam or you have made a payment, please provide the proof of payment. Please provide the P number or the ID number for us to access the information. Because if you just ask if you qualify or if you've made a payment but you didn't share the payment details, then we are unable to assist with that. Okay, and then this is just, I hope I'm still on time. Let me see. Yes, we're still in time. So we have a survey that we like you to complete. So this is just the link or the QR code for you to complete the survey. Let me see if I didn't miss out. I was just going through so fast to make sure we. I think we are good. Let me see if we have here. Okay, yeah, this is the survey. If you can complete the survey, but in the meantime, the communications team can assist with questions and going through those questions before we close the session. Mr. Vuma, any or any of your team members, do you see any questions on your side?
Okay, so we have one question. It
Okay.
says, can you please elaborate on the day 1 and day 2? Because I thought it was a 1-day exam.
Okay, so in terms of the post-basic EISA, like I said, there's 2 days. The first day would be, or sessions, let me say that, yes. So there's 2 sessions. So you first write the calculations and then write the general session after. Is that the clarity? Is that enough?
Okay, that's the only question for now. We can give him some time to drop some in the Q&A section.
May come in, just explain that again, whether it's 2 days or just 1 day. I think maybe the clarity needs to just come through as well.
Yes, so currently it will be a 2-day session. So with one day being just the 1.5 hours, and then day two being 3 hours.
I think I might have caused that confusion earlier because I said that it was one exam. So it's
Yes,
considered as one exam, but it's
it's one
written over
exam,
2
yes.
days.
Yes. So it is one exam with 120 questions, but then it is treated as two separate sections. I hope that makes sense. Katevuma, is that okay?
Clarified, thank you.
I think.
Maybe just bring back the attendance register slide.
There's a question. Is there a date for the practice EISA yet? Enough time should be allowed for planning leave.
Yes, we will try. So in terms of the EISA, we're hoping that we'll still have it in 2025, and then the practice EISA, we're hoping that we'll have it in 2025, but we will share the details way before the exam, because as with the normal EISA, you still have to book. So we will communicate that well in advance. Thank you.
Anonymous asks, but why 8 weeks? I've waited almost 2 years to write.
So the 8 weeks is for the results. If I hope I'm getting the question right. Is it the release of the results or the writing of the practice EISA and the EISA? In terms of the results, it takes a minimum of 8 weeks for the results to be released. But in terms of writing of the practice EISA and the EISA, we don't have the timelines as yet. We're looking at the dates, but we are hoping that we'll have the practice still in 2025, and then the actual EISA beginning of 2026. Okay, still waiting. If there are any more questions, we still have 7 minutes to go.
So we have another clarity seeking question about
Wait.
the dates. It says, is the beginning of 2026 January? Because I was
January,
assured that the EISA will be in December 2025.
Yes, so what we're working on, and maybe just a bit of a background, the approval of dates for 2026 hasn't happened as yet, but we're working on making sure that we have it the very beginning of 2026 in January. But in terms of practice, because other people, and like I said, there's 3 categories right now of people that are considered qualified post-basic, those that are registered as learner post-basic under the occupational certificates and the former BFAM. So accommodating all 3 means that we can't just afford people an opportunity to write the exam without writing the practice. So that's why we will start with the practice, and we're working very hard to make sure it is still in 2025. And once you've written the practice, then we will now prepare for the actual EISA for beginning of 2026. Thanks. I hope that's enough.
Can we access the slides of this meeting?
Sorry, I didn't get that.
Can we access the slides of this meeting?
Yes, this presentation will be saved with the manual and any other relevant documents on the website. Like I said, please give us until next week, Friday, to make sure that all the information is saved on the website. But yes, under the registered persons, learner, that's where all the information will be saved.
The last ISA exam, my invigilator responded a few hours after the exam. I have anxiety about this occurring again.
Sorry, I don't know if it's my audio is a bit low. The last exam?
The last ISA exam, my invigilator responded a few hours after the exam. I have anxiety about this occurring again.
So we have the option to use the WhatsApp, but if the WhatsApp doesn't work, you can always call us or use the chat option available or on the platform. So if all 3 are not addressed, I will be very disappointed, but we do try our best to make sure that we respond timelessly.
So for now, we ignore the email about the 2nd of December. That was for basic.
Yes, please do ignore. So the 2nd of December is the basic EISA. So if you receive that, please do ignore. Okay, I'm just going to move now to the next slide. If you want to follow the SAPC WhatsApp channel, this is the link in the QR code you can scan. And please feel free to just come in if there's any more questions.
Consider the last question just came through now. It says, so we are writing only the practice EISA this year and the actual EISA next year.
Yes. So one of the requirements or criteria to qualify to write the EISA is that you should have written the practice EISA. So we will start with the practice EISA in 2025, and then for 2026, then we'll do the EISA.
Okay, those are all the questions.
Okay, those are all the questions. So if that's it, I can hand over to our communications team, and thank you everyone for making time to join this session. Have yourself a wonderful day. I'll go to Mr. Boom. That's it from my side. Thank you.
Thank you very much, Mr. Senator. I believe the session has now ended. So yeah, thanks everyone for joining. till next time.
Okay, thank you, Dr. Fogatis. Thank you, Mrs.
Thank you so
Berry.
much.
Okay, bye,
Thank you,
everyone. Thank you,
everybody.
communications team.
Have a
Bye.
lovely afternoon. Bye.
You too, bye.